Cardiac Healthcare in an Aging Population, a Machine Learning Approach. Doctors Malin Overmars. This video is narrated by an AI-generated voice. The European population is aging. For healthcare, this means a strongly increasing pressure with rising costs. This particularly applies to cardiac healthcare since older age is associated with a higher risk of cardiovascular diseases, such as coronary artery disease. Recognizing symptoms that indicate a problem in the coronary arteries is complicated, because complaints are often very diverse, especially in patients without known risk factors. Therefore, extensive cardiological tests are often necessary, including time-consuming and expensive imaging, such as CT, SPECT, and MRI scans. Practice shows that in many cases the imaging did not show any abnormalities, and it turned out that the cause of the symptoms was located somewhere else than in the oxygen-supplying vessels of the heart. In these cases, this expensive and time-consuming imaging proved, in retrospect, not to detect the origin of the symptoms. To meet the increasing demand for care, the healthcare sector should manage its available resources more efficiently. Therefore, a prediction model that can rule out problems in the vessels of the heart before imaging is performed would be of added value. Ideally, the model predicts the negative outcome of the cardiac scans without them having to be performed. The systematic collection and storage of electronic patient records makes it possible to use large healthcare data sets for the development of this prediction model. Moreover, computer systems can find patterns in very large data sets, patterns that cannot be seen by the human eye. Therefore, new data sources can be added to improve the prediction, such as ECGs and routinely generated blood biomarkers. For example, we collect cell-based parameters that facilitate differentiation of cell types in all patients, data that are not reported in the patient medical records. To predict the absence of cardiovascular disease on CT, stress SPECT, and stress CMRI, we developed XGBoost models. These are extreme gradient boosting algorithms, based on multiple decision trees. The main advantage of XGBoost is that it is able to deal with missing values, which is an important characteristic of electronic health records. Imputing is not necessary, which normally introduces a strong form of bias. Recently it has been shown that complaints indicating cardiovascular disease generally differ between men and women, possibly due to differences in the type of vascular damage in the heart. Men more often have problems in the large vessels of the heart, women more often in the microvessels. Vascular damage in the microvasculature can only be detected on cardiac stress MRI or stress SPECT scans, rather than on a CT. Therefore, it is important to consider not only the exclusion of cardiovascular disease on CT, but also to include cardiac stress MRI and stress SPECT scans. Hence we developed sex-stratified XGBoost prediction models to predict the absence of cardiovascular disease on CT, stress SPECT, and stress CMR. Model performances show high negative predictive values and acceptable specificities. We did notice differences in predictor variables for the male and female models. For example, we see that the average size of neutrophils plays an important role in excluding vascular damage on CT in women, while the number of neutrophils contributed to the prediction of absence of vascular damage on CT in men. This suggests a difference in underlying etiology, and shows what the added value of hematological parameters might be for excluding cardiovascular disease, besides known risk factors. In conclusion, this study provides promising results for exclusion of cardiovascular disease using electronic health records, including extensive hematological data. The algorithms may help guide clinical practice for individual patients and improve the sustainability of the healthcare system. Preventing unnecessary imaging in patients suspect of coronary artery disease through machine learning of electronic health records. European Heart Journal, Digital Health, December 2021.